thank you everyone for taking time and joining us today live on the occasion of International Women's Day. Every year, the IWT community marks the call to action for accelerating women's equality. Well, this year's theme is Accelerate Action. According to World Economic Forum, it will take until 2158 to reach the full gender parity if we continue at the same pace. That is almost 5 generations from now. So we do need to accelerate to speed up the rate of progress worldwide. Several key areas can help us advance gender parity more quickly, like enforcing legal and policy reforms, promoting economic empowerment, and increasing women's leadership and representation. Having said that, let's start today's Women's Day talk. I am your host, Priti Cherian from Priti Bakes. Priti Bakes is a home bakery where everything is made from scratch, freshly and hygienically, and most importantly, with love. I bake cakes, cookies, birthday cakes, breads, brownies, muffins, and a lot more. Please check my Instagram and FB pages to see the list of available items. I will be posting the links to my Instagram and Facebook in the comment section. And let's welcome our guest for today, Dr. Lalitha Krishnan. Welcome, ma'am. So, Dr. Lalitha Krishnan did her schooling in St. Joseph's Convent in Jabalpur. Her MBBS and pediatrics post graduation was in Christian Medical College, Vellore. She trained in neonatal intensive care at Sydney, Australia. For the last 35 years, till her retirement, she had been a professor in medical colleges. Post retirement, Dr. Lalitha and her husband, Dr. K.V. Krishnan, decided to continue to serve the community in a novel way. They got together a group of senior physicians and started telemedicine services, a second opinion. We welcome you all, Dr. Lalitha. So let's start the
Thank you.
talk.
Thank you
So,
very much.
ma'am, so let's start the today's talk by telling to our audience that what is second opinion.
Thank you, Preeti, for the introduction and sorry for the disturbance just now.
Problem.
Second Opinion is a telemedicine site started and run by a team of senior experienced doctors, each with about 20 to 35 years of experience. It offers a 30-minute video consultation and is for both first time and second opinions. Emphasis is given in this consultation to patient counseling. We have all felt that not enough time is given to talking to patients by busy doctors. This is followed by a clinical summary and a prescription. We do not have any advertisements on our website, and we are not affiliated to any labs or pharmacy. Another unique feature of our telemedicine is that whoever the patient chooses can join the consultation from anywhere in the world. Now, on Women's Day, I would like to tell all our viewers how telemedicine is very convenient for women. It is private and from the comfort of home. Some examples are premarital and pre-pregnancy counseling, counseling for irregular periods, PCOD, infertility, any anomalies detected in the unborn fetus at 20 weeks, anything to do with menopause, sexually transmitted diseases, skin problems, especially in covered areas. Anything you need information about contraception, vaginal discharge, vaginal itching, all these which cannot be done in busy gynecology clinics, though right now they are being done, can be done through telemedicine.
Okay, ma'am. So does that mean that if I am a new mom and I have so many concerns regarding how to feed the kids and all, and usually when we go to pediatrician, they have to rush because they have a lot of patients. So if I log into second opinion, will the doctors take time and help me to teach the basics of what to feed, how to feed the kids, and things like that?
Certainly, breastfeeding is an art which is very difficult for first time mothers to learn. There are people called lactation consultants, but there are very few in India. So, doctors, pediatricians, especially ladies like us who do neonatology, we do offer breastfeeding consultation. We can look at the breast and the feeding online and give counseling. So, it is an excellent method to learn how to feed your baby, what are the problems in your baby. So, very, very important for new moms.
That is a really great service, and thank you for telling about us. I am sure many of our audiences do have would like to hear an expert's opinion about what is going on with their body. So now moving on to our next topic. So we are going to discuss about certain internet trends that we see on social media, and we often wonder whether it is right, wrong, and should we follow it or not. So first trend which I want to discuss with you is about the superfoods. Every now and then I have heard sometimes it is the avla, sometimes it is the makhana, uh, and ghee. Ghee is a recent superfood which I have heard. I want to know, is there really any superfood?
Thank you. That's a good question. Over the years, in my experience, I have found that what science tells us one day, after 10 years, when more studies are done, when more evidence is accumulated, you start having doubts. Now, regarding the superfood, there is no one superfood. I feel personally moderation is the key. If you see
Hmm.
rasgullas in front of you, eating one is better than eating three. The other thing is a balanced diet. So every plate that you set for yourself for breakfast, lunch, and dinner should be balanced in terms of all the macronutrients and the micronutrients. I would suggest to all women be sure of what goes into your mouth and your family's mouth. And the only way to be sure is cook most meals at home. I know we all need a break. Let eating out be an occasional treat.
Yeah, that is so true. So, cooking food at home is the real superfood because we can control what is there in our meal, right? So
Yes.
true. So, ma'am, similarly, apart from the superfoods, we also have a kind of diet phases. So sometimes it's a keto diet, sometimes it's a paleo diet. Every season there is a new diet coming and telling us that we should follow this for a good health. And now currently, we are hearing more and more influencers talk about proteins, that we should include more proteins in it. Is it true that we should be including more proteins in our food?
Now, there have been specific diets for certain conditions. So, we should not get confused whether it's for everybody. For example, a highly ketogenic diet does help in cases of epilepsy, for example. But these are diets prescribed by doctors to specific patients. Now, regarding the proteins, Indian diet is basically carbohydrate heavy. Now, the reason why it was carbohydrate heavy in the olden days was it was easily available, rice could be grown everywhere, and our ancestors burnt off all the calories by hard work. The National Institution now has recommended that protein intake certainly has to be increased in the Indian diet. And the government is even making efforts to give dal in ration shops, which was not there before. Now, all of us, men, women, all of us, adults, need about zero point 0.8 grams of protein per kilo body weight. So, a 60 kilogram woman will need about 50 grams at least of protein per day. To put it in perspective, 1 cup of cooked white or brown rice has only about 2.7 grams of protein. So you need to eat a lot of rice to be able to get that much proteins. Now that is where the problem comes in India. Dal, paneer, etc. are good sources of protein, but dals also have a lot of carbohydrate. One must remember that. And paneer has a lot of fat. So people who consume and can consume non-vegetarian food are little more lucky, but it becomes very costly. The best source of protein will be probably eggs for those who can eat eggs. But for those who cannot, a combination of dal chawal. For example, parpu sadam, khichdi, pongal. This gives you a complete protein. And also similarly, wheat roti, dal and potato together can be a good source of protein. So to sum it up, protein is important. One must constantly look for good sources of protein, but it should be part of a balanced diet and probably no more than 50 or 60 grams per day for a normal adult. The 100, 200 grams of protein is for bodybuilders, not for ordinary people like us.
Okay, ma'am. So thank you for giving us so good information about our health and what we should eat and what should not. I would like to know, like, if you people, our audience, if you are enjoying our talk, please give the thumbs up on Facebook so we will know that you are enjoying our talk today, or give a heart. And please share the link with all of your friends also, so they could also join and get benefit from this Women's Day talk. And any question at any time, if you have, please post it on the comment section so we can take those questions also during the interview. Thank you so much, everyone. I can see some hearts, like, and love. Thank you for showing that much love to us. So, as Dr. Lalita just now said, that we do need proteins, but in moderation. So, with that thought, I would like to tell that currently Pretty Bakes is also coming up with new products, which you will see in the coming days in my Instagram and Facebook, where we are trying to include more healthy nutrients into our snacks. Like we have tried with our protein-rich cheesecake, where the traditional cream cheese is substituted with paneer to make it more protein-rich. And we do not have a biscuit base in that. It's the base made with nuts and dates. And taste a little different, but if you're really health conscious, I think it's a very good alternative. Recently, we did a stall where we shared our healthy snack bar. Each bar is only 90 kilocalories and made with only dates, peanut, and chocolate. And we had a really good response from everyone. Like, it sold out once who the people tasted, it was all sold out in few minutes. So please do keep following us on Facebook and Instagram to know more updates. And on that same note, I do remember one of the video of Dr. Lalita. In if you go to her YouTube channel, you can find many useful informations like this. Along with that, one particular thing which I remember is making of baby pongal. So a pongal made without even sharkara. So that is really good for giving to the kids and also to the adults who are very health conscious and don't want to include sugar in their diet. So let's I will share the link now in the comment section. After the talk, you can go to that YouTube link and see the recipe and try it if you like it. So moving to the next topic is the fitness. So we do see on the internet every time that doing some 50 squats, some push-ups, this number of repetitions and all is what going to make me lose weight in a month or so. So I have never seen any results like that. But ma'am, is there any fitness which can really work out like a super workout which can help all the women out there?
Yeah. Now, regarding fitness, whatever we try to do should be for life and it should be sustainable. We should have time for it and we should not get bored. And what we have all realized over the years, it's better to move than not move. So, point number one is keep moving, go open the door yourself, pick up the phone yourself, walk while you're talking on the phone. So, there's no substitute to constant movement. All your do it yourself daily activities go a long way in providing this movement. Incorporating walking, climbing stairs, shopping nearby also contribute. Now, things like going to the gyms, having personalized instructors, using health apps, all of them work while all this support is there. And then we all know that we have regained the lost weight. So there is no such one regime. I think it just means substituting a lazy lifestyle with an active lifestyle.
Okay, ma'am. So, what about this? Recently, I've seen two or three influencers who were telling us that if moms and dads should be doing more of strength training. Is it true? Is it safe?
Yeah, one more thing what I can suggest is if fitness is the only goal for a person, then along with mindful eating and being active, probably a dozen Surya Namaskar every day should take care of maintaining your fitness. Now, losing weight is different from maintaining fitness. So, irrespective of the weight, irrespective of what you're doing, I think having fitness should be the goal. So basically, I would say that the strength training, probably I'll talk a little later. But what I would suggest to everybody is don't fall for an ideal body weight. Don't look at your BMI as such. Unless it's in the very unhealthy category, then you should be consulting your physician. But if it is in the normal range or just above normal, you can just look for good health and fitness in your workouts. But for eating, I would suggest eat only in the dining area. Don't sit with a packet of chips in front of the TV or while you're watching something on the phone. And now we know even Sadhguru has said chew food at least 24 times before swallowing. And serve yourself small portions in small plates. They recommend having a 6-inch plate, but nothing more than 9 inches radius, diameter. So you should have a small plate, serve small portions, chew the food many times, sit only in a designated dining area, and be active. I think that is the best fitness advice I can give after trying out many things for 40 years.
Correct, ma'am. And what about strength training for elderly population?
So definitely strength training is a concept which is of late come into being because elderly people also have started watching TV. That's all we do nowadays. You sit and you watch TV, and then you tell your grandchild, get me some water. Then your daughter in law brings you some tea, and you're doing everything around the TV. So I think strength training has now come to dominate social media because people feel that muscles are going wasted because of this sitting. And along with muscle decay, you will find your bones have also become brittle and soft. So it's very important that we do strength training. Now, how do you go about doing strength training? You can't just, one cannot pick up a set of dumbbells and start doing something that is being shown on TV. Second question, why is strength training so important? The most important thing in strength training is it prevents falls. Now, one of the major problem in old age and for elderly people is falls. Once you fall, you're bedridden and then you can't do any of your activities and the muscles and bones become weak. So even in a second opinion, we have geriatrician, we have orthopedician who can give you a combined advice on the state of your bones and tell you how to prevent falls. Now, can we do it at home? We can do strength training at home, but initially proper guidance is very important. Maybe you should get a physiotherapist to come and teach you what is the weight you can use, how often you should do it, which are the muscles groups that should be trained in your case, because each case can be different. Or you can attend classes for some time. Whatever it is, start slowly, increase the intensity. Don't be over enthusiastic in the beginning because then the muscles pain and then you stop doing altogether. So do little by little till your muscles build up and then you are increasing the intensity because injuries can happen without supervision. So this is what I would say in toto about strength training.
Very right. So, after getting so many good, informative information, I would like let's give shout out to Dr. Lalita. Show thumbs up, love, and other emojis. You have smile emojis if you are liking what we are talking about today. And you have really touched very important topics like how we are sitting and making others walk around us and not leading a active lifestyle. Which is why we need all these extra things apart from what our parents were doing before. So if we really are comparing, we should also compare the activity level that has reduced over the time. And ma'am, coming to like one topic which is really close to my heart, seeing the mom influencers on your Instagram. So I follow different types of mom influencers. Some are like teaching their kids so much that I wonder whether the school is teaching them anything or not. Some are very, very good in home organizing, buying stuffs to make your home look like a hotel or something. Some are making three or four items for one single tiffin dabba for a kid who is going to only UKG. So all these things, even though we know how much realistic is unrealistic it is, and we sometimes forget that there is a big team behind it who is cutting, chopping, cleaning the house, looking after the kid while the mom is making the video. And we unnecessarily put so much stress on our head. And already society is putting so much pressure on us to be a good mom, good mother, good wife, good woman. How do you tell to our listeners today, like what we can do to handle this stress?
I agree with you, Preeti. The question had many different points, and I agree with all
Yeah.
of them. I think these kind of social media has become a menace and a nuisance. They do not allow us to be ordinary human beings. We have to be super human beings, super wives, and it can really take a toll. But having said that, there are good things one can learn provided we know how to separate the grain and the chaff. The media should be used to our advantage, and we should not become slaves to this media. I think we should dominate the media. And if, because if you don't use media intelligently, it will definitely lead to stress and even ruin family relationships. So we have to go to these media. We cannot avoid them, but pick up what you need and do not allow yourselves to be dominated by what is said there.
Okay, ma'am. That is true. So, does this mental health has impact on our fitness?
To put it simply, a mind that is not happy will not care about its body. We have noticed ourselves many times that when we don't sleep enough, we have had arguments at home, or we are worried about something our children are doing. The first thing, what do we all do? Let's cancel gym class today. Let's cancel my exercise. Let me just lie down and eat something nice and fatty so that I feel comforted. And also, I must include all those women who suffer from postpartum depression because they also then cannot get themselves up to get back their bodies in shape because it's very difficult. Their mind doesn't allow you to move. So, meditation, drinking lots of water, keeping your mind positive is what will help with fitness.
That's right, ma'am. So, if any of our audience, in addition to all the questions which we are talking about, if you have any question on that topic or any other topic, please post it so that we can take it after we finish this discussion. We are almost wrapping it up. So, if you have any question, please post it in the comment section. So, as a source of inspiration, I would like to tell to our viewers today, I met Dr. Lalita in Zumba class. So yes, Dr. Lalita was also doing Zumba some time ago when I was also joining the same class. So there is no age barrier, like she told. We have to keep fit. We have to find. I remember those times also. Whenever I ask her, she will say, "You have to keep fit." Now I'm retired. I have time. I have to do something to make myself active. And that is the inspiration I want to keep for all the age group here. We all need to be active for ourselves. And if we are healthy, we are good, then only we can be empowered. and we can like take care of our family, take care of our job, right? So I have one question from the audience: how to improve our immunity? What suggestion will you give, ma'am?
Now, barring, of course, being a medical person, immunity to me means a lot different from what it means to lay people.
To
The
us.
word immunity became fashionable after COVID, and everybody wants immunity. Now, there are conditions where people are born with less immunity, and those are medical conditions. So, if you remove those kind of people, for all of us, I think good healthy habits and balanced diet and hydration. There is really no getting away from all that. This is what builds immunity. I mean, you need good circulation of blood to go everywhere in the body. It should take oxygen. It should nourish your tissues. It should give you healthy muscles. And then, the same blood goes to your nose. People said, don't put your fingers in your nose, don't do this, don't scratch pimples. Well, everything means keeping yourself hygienic and keeping yourself healthy. Really, there is no special message to give that you drink this or drink that, and then you will get lots of immunity if you're sitting in bed all day and watching TV.
That is correct, ma'am. That is so true. There is no one stop shot except for vaccination to get more immunity, right?
Yeah.
Yeah. So, ma'am, like recently I came to know that our vaccination doesn't stop when we turn 18. There are many vaccinations available for us adults also. Would you like to tell our audience today, like enlighten us, how to like, is there what are the some mandatory or good vaccination which we should definitely consider taking it in our adulthood?
There are, like being a pediatrician, I will probably be more competent to talk about children, but I do have some idea of adult vaccines. So, yes, there are vaccines for adults. In pediatrics, also, there are two types of vaccines. One which is given by the government, which everybody has to take. I mean, it's not like a law, but the government covers all children with these vaccines free of cost. There are some called optional vaccines, which the government would like to give free, but right now they are not made in India and they are expensive. So, those vaccines also parents must consider for their children and talk to their pediatrician about it. So, there are essential vaccines and there are optional vaccines. So, please do go back and talk to your pediatrician about it. The adult vaccines, yes, when you take vaccination as a child, when you grow older, the vaccination immunity due to vaccination tends to come down for certain diseases. There will be adults for whom, as children, those vaccines were never given because they were not available. So, those adults also fall in the risk group of needing vaccines. So, definitely the vaccine for what we call shingles, the vaccine, the DPT, which we give as children, which we get as infants, in a modified form is given later. Then there are this vaccine for pneumococcal bacteria, which causes pneumonia in the elderly. Now, nowadays, all children get a pneumococcal vaccine free of cost from the Indian government. But we as children, people who are above 10 years old now, would not have got that free unless you gave it as an optional vaccine. So there are a list of, so my message would be, please approach your adult physician and proactively ask him, are there vaccines for adults which we can take? It definitely brings down the seriousness of the disease and prevents death. Because remember, children are vaccinated, they go to school and bring the germs home unknowingly, and there are old people in the house. They can get it from the children, but the adults don't have the vaccine. So they can become very sick. Child will be well, the tata will become very sick. So my message is, please go back to your physician and talk about these adult vaccines to them.
Oh, good, ma'am. So one more question from our audience. like after menopause, the women suffer a lot of calcium and their bones become weak.
Yeah,
So, and
yeah,
many women are also suffering from osteoporosis. So,
yeah.
what suggestion you will like to give to us to improve bone strength after menopause?
Okay, now this is very, very important, like I mentioned before, for to prevent fractures, falls, and fractures. Now, this should be taken care of from the young age. So while you're 30 or if you're 25, 30, now start doing exercises and eat the right diet, eat your calcium tablets and measure your vitamin D levels. But if right now someone is elderly and has osteoporosis, the best person to evaluate and treat you would be an endocrinologist. It a combination of an endocrinologist and a gynecologist, or a combination of endocrinologist and orthopedician, or just an endocrinologist, is important to give you the right advice about how to manage your osteoporosis and a more severe condition called osteomalacia. So it is women who are older now and have already developed osteoporosis would need medical advice to prevent fractures.
So, as we are waiting for the audience question, ma'am, I will take up one question which we were talking about. I saw your interview with Ashok, which who we famously known as the Masala Lab. So, with the Krish Ashok, you talked about milk as the superfood, one superfood which we are talking. I'll share the link here on the comment section. They can also see that video. It's very informative. So, would you like to tell to our audience here about something about what, like, so one of the audience has asked also how much breast milk is enough for my baby? How to tell? Can you
Now,
please tell?
I want to correct. The video is not milk is the superfood, it is breast milk is the superfood.
Breast.
Uh,
Sorry,
because people,
sorry.
because as it is, we have huge fights in families about them telling the children, you must drink milk, otherwise, this, that. You know, there are so many conflicts about cow's milk. So, the topic in question is about breast milk. And breast milk, no doubt, is the superfood. So the breast milk should be given to newborn babies for 6 months after birth, only breast milk. And all of us, doctors, nurses, lactation consultants, we should all, and family, should encourage the new mother or a breastfeeding mother with her breastfeeding. Now, how will a mother know that the milk was enough for the baby? There are three signs that one must watch for. The first is the baby drinks for about 20 minutes, preferably from one breast at a time. And at the end of the feed, his eyes just go and the lids become heavy and the baby falls asleep in the mother's arms. That is the first sign that the baby has drunk to his satisfaction. The second one is the baby wets, thoroughly wets at least six pampers or nappies in a 24-hour period. You would have changed him or her at least 6 times because the nappy is wet with urine. So when a baby drinks good amount of breast milk, the baby will also pass good amount of urine. And the third one is the baby gains on an average 30 to 40 grams of weight per day. That if you take a 7-day average, it will be about 200 grams in a baby. So these are the signs that will tell you that you are giving enough milk to the baby.
So, throughout the session, you have told us various advices for different groups of women, like from kids, then adults, then ladies near to menopause, and then our elderly population. Would you like to summarize it for our audience?
What I have learned in so many years is the best advice is the advice that is not given. Nobody wants advice. But having said that, let me summarize for you, for all of us. Uh, at all ages, Diet, a good diet, balanced diet, homemade, being fit, my, looking after your mental health, and looking after your physical illness are important. Now, this is irrespective of age, it's important. Young single girls and women, young women, remember that knowledge is power. Never hesitate to learn new things. Do not blindly follow what others are saying. Ask yourself questions. Take charge of your career, health, and future. So, for young people, setting out after plus two, setting out after college, very, very important. Now, if you do have problems, menstruation or any other problem, you have clarifications you want from the medical community, I can assure you, second opinion is a good place to go to because it's online, it's private. You can write down all your questions and ask the doctor whatever doubt you may have. One simple example I'll give you. You may want to get married, and we want to see, you have doubts about whether your blood group is compatible for baby, whatever. There is a definite list of premarital checkups which nowadays pediatricians and gynecologists are recommending, so that after marriage you can be aware of these problems before having a baby. Older women, women after 30, we must all keep track of our weight gain. I mean, if you're already overweight before that, that's different. You will definitely go to ask for help. You need, endocrinologist, or you need an obstetrician, or you need a physician. All that is fine. But after 30, keep track of weight gain, because women become self-sufficient. You have gone up the ladder. Financially, you have become well off. So intake of calories also increases. And work comes down, metabolism comes down, because now we have a car, we can have people to do work for us, especially the delivery services. They are contributing heavily to lack of activity. So be mindful, keep your weight on track, build up your muscle and bone health, so that in old age you can be healthy. Elderly women, now generally this group is our what, in second opinion we have a geriatrician for this. Women over 60 have completed their careers, retired like me, we are at home. Children have left, gone for jobs, have raising their families. The spouse may be well, the spouse may be sick with problems. Now, this is the time when mental health becomes a big problem, a big challenge, along with our physical ailments. We have that also. But we are worried about the children, worried about spouse, worried about income. So now it becomes equally important, that little bank balance of health which you created when you were 30 will come in handy today. We should avoid falls, we should be mindful of looking after our health, because only then we can look after the family. So this is roughly, I would divide a woman into three stages of life, and we can look after the family this way.
Thank you so much, ma'am. Thank you for your words of wisdom. I'm sure all of our audience would have got benefit from it, and it's something to think about. Many of the things we know, we heard, but we are not sure whether it is coming up, because nowadays a lot of information is available because of the social media, but we just don't know whom to trust, whom to follow. And talking to a doctor definitely helps. I'm sure our audience would have made up a mind up till now to understand, like, okay, this information I should consider reviewing with some other doctor and then only follow it. And I wish everyone very good health and fitness. Uh, we are very much thankful for joining us today, and also to the audience who are going to join and see this recorded session. It will be available on my Facebook page, and I'll share the link on Instagram as well. Thank you for taking up this time. If you have any other questions for me or for Dr. Lalita, please comment it. Yes, ma'am.
I must personally thank you for inviting me to this session. It has been wonderful. Preparing also was wonderful. And thank you for giving this opportunity to a second opinion also.
Thank you so much, ma'am. The pleasure was mine also. I'm doing this for the first time, so I am sure there would be so many flaws, some things could be done better. So we are very much open for the feedback. Audience, please uh, send your comments, or even you can DM us, directly message us on WhatsApp or Facebook, Instagram, to tell us did you like, and if you want anything session like that with any other doctor, or not with the doctor, with somebody else, please let us know. You don't want me, but Dr. Lalita with somebody else, that is also fine. Please, you're welcome. Thank you for joining us. Have a good health, good mental health, good fitness, and I wish more power to all of us ladies here. Thank you.
Thank you.